Dr. Natalie, before we dive into everything, I know you received your first vaccine dose just before Christmas. We haven't talked with you since. How are you feeling? How did it go for you?
Oh, I'm feeling absolutely fine, Chanel. I had a little bit of a sore arm for literally less than 24 hours and no other side effects whatsoever. I do anticipate having a few more next week when I get my second dose. That's typical, but again, it's a sign that my immune system is working, so I'm not necessarily dreading that.
Absolutely. We can deal with the sore arm. Dr. Azar, as Tom just said, despite guidance from public health officials to stay home, people miss their families. I think that's just the reality. Millions of Americans traveled over the holidays. What can we expect to see in the weeks ahead? And for those folks returning home, is there anything they can do?
You know what, Chanel, I am worried that we're going to see the numbers get worse before they get better. And sure, I understand that people wanted to see their family. People need to keep in mind, however, that they don't want to become a statistic themselves, and they certainly don't want to transmit to other vulnerable people. If you did travel for the holidays and you returned home yesterday or today, you should essentially quarantine yourself for about 7 days and get tested in about 3 to 4 days and continue, of course, mask wearing and social distancing. That's the best guidance right now.
Okay.
And Dr. Natalie, we've been hearing so much about this new coronavirus variant. It's been found in a few states, Colorado, California, and Florida. So what do we know about this new strain, and is the vaccine going to protect us against it?
What we know right now, Dylan, is this. We do know that it is more contagious, about 70% or so more transmissible. At the moment, it does not appear to be more virulent. That is, it doesn't cause more severe disease. It doesn't appear to be deadlier. And for now, we think that the vaccine is still effective and protective against the variant. It's important, however, to point out that just because it may not be deadlier per se, just by sheer numbers, the absolute numbers of hospitalizations, and then following that, deaths will happen just because more people will be getting infected. And the best protection is what we've been saying all along. I don't need to repeat myself. You know what you need to do.
And going back to the vaccine, we are starting to see more groups beyond healthcare workers getting vaccinated. What do we do at this point? Are we supposed to be calling up our doctors and just finding out when we can get the vaccine? How should this next phase work?
So I know it's caused a lot of confusion and it feels a little bit chaotic and it does for us as well. I have patients who are reaching out to me asking when their line in the queue is up. What I will say is that if you are part of a bigger hospital system, notifications probably already went out to you that you will be notified when it's your turn. I have to say that there is no real formal blueprint for this. The states are allowed to make these allocation decisions themselves. So certainly I would say, yes, you can reach out to your doctor, but he or she may not actually have an answer for you at the moment. Just know that we are all working on it and patients will be notified when it is their turn to get the vaccine.
We have time for one more question. Yesterday on another morning program, Dr. Slaoui, a top official of Operation Warp Speed, said that health officials are considering administering half of the dose for the Moderna vaccine to speed up the rollout to more Americans. What does this mean exactly, and how would that, per se, help ramp up distribution?
Well, to answer that part, Chanel, it wouldn't help to ramp up distribution, which is why certain experts, such as Dr. Fauci, have said that may not necessarily be the solution. But this is predicated on information and data that we have from the earlier phases of the Moderna trial, which showed that half of a dose was as sufficient as the full dose in eliciting the immune response, but in the laboratory. This was not something that was studied in the big phase 3 trials that we're always talking about. I can assure you that there is a very lively and robust discussion on Twitter about this right now between and amongst virologists and vaccinologists and public health experts. I will also say that it is very unlikely to be sanctioned by the FDA without a thorough review. So right now, it's pretty much of a wait and see.
That makes sense. I'll tell you what, Dr. Azar, after talking to you and hearing from Tom Costello, it's very clear we're still in the thick of this, and we just have to hold on a little longer. Thank you for talking with us this morning.